went back to college and decided to go to med school. Obviously, dancers and doctors are the same people. Lots of workaholism, lots of perfectionism, some narcissism, but I knew that I could work hard. And so work kind of became my drug of choice.
Welcome to Success Reimagined. I am Dr. Amna Shabbir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. Hello and welcome back. Today I have a very dear friend, a very special guest, Dr. Kara Pepper. She's a practicing primary care internist and executive coach in Atlanta, Georgia. After 14 years in private practice, Dr. Pepper built her own 18-state telemedicine practice for adults across the Southeast, especially those with eating disorders. In addition to her clinical practice, she provides executive coaching and is the founder of Micro Practice Mastermind, a community for physicians transforming healthcare through solo practice. Dr. Pepper is the podcast host of the famous It's Not Just Youth: Stories of Survival, Humanism, and Career Sustainability. Welcome.
Welcome. Thank you for having me.
It is an honor. And I know that I've been trying to ask you some questions surrounding this very particular topic, Kara. People know many parts of your journey, and you've so courageously shared, not just on your own platform, but at other places and spaces. Today, we are going to pick a very specific part and kind of dig deeper into that. So my first question is going to be, how do you define perfectionism? What does it mean to you?
Yeah, the definition that's the most succinct comes from Brené Brown, which is basically that perfectionistic behaviors are adaptive behaviors designed to help us avoid feelings of discomfort, normally like shame or regret or failure. And so for me personally, I recognize that the things that on paper made me look great, overworking, high achieving, absolute necessity to be right and to be perceived as competent. A lot of those things I perceived as being helpful, but they also were adapted behaviors to help me avoid feeling like I didn't know like what I was doing to take care of patients, or feeling embarrassed in front of my superiors, or feeling the sense of failure that I'd not passed a test. So it shows up in those ways that we don't always recognize as, classic perfectionistic behaviors.
It's very sneaky, you're right. The way we think perfectionists are and what's happening actually behind the scene, it's completely different. Many of my audience members, like I know, will kind of know your story in terms of the work that you're doing in medicine. And so stepping away and going into a chapter and moment of your time where you were actually a ballerina, I want you to take us to that journey and tell us more about that chapter of your life. I know I started with the question of perfectionism, and so let's see where this journey takes us.
That's right. Yeah, I as a kid thought I wanted to be a ballerina and had this very unique opportunity to move to Moscow, Russia when I was in 8th grade, and left home to go train with the Bolshoi Ballet Theater. And when I came back after 6 months, knew that if I wanted to dance professionally, I couldn't live at home. So I went to professional arts boarding school in North Carolina and then got a job dancing. And in terms of perfectionism, the high achieving part of your brain, the part that's I want to learn, I want to try and fail, I want to continue to grow, that certainly there's space for that in dance. But the kind of pathologic perfectionist part of my brain was like, it has to be perfect at all times. If I'm not the lead dancer on stage, therefore I'm failing. If I don't get all of my turns perfect, therefore I'm no good. It's like this all or nothing thinking that plagued my career. And, couple that with nutritional issues like eating disorder behavior. You have to have the perfect body, you have to have the perfect look. That's certainly perpetuated by the culture in dance, directly by the person who was employing me, having lots of comments about my body size and shape, even though I was quite tiny. All of that fed into this never ending loop of it's not enough, therefore I'm not enough. And so the perfectionism, I would have told you, was really helpful, but I recognize now in retrospect that it ultimately led to the decline of my career. I had eating disorder related injuries that ended my career abruptly after about 3 years, and I had to make a pivot towards what I'm doing now.
Wow. I just want to pause there for a second. Did you just say that you left home at in 8th grade and then you were in a boarding school? I did not know that part of your journey.
Yeah, it was really wild. The Bolshoi Ballet, which is, a world-renowned company, came over in partnership with Gerald Ford, our previous president, and he has a amphitheater and arts legacy out in Vail, Colorado, so brought them over, and by sheer luck, I got accepted to do a dance summer program out there for 6 weeks, and at the end of the program, they invited 4 of us to go back and train in Russia. That had never been done before, and so 2 of us went, and so I still ask my parents, like, "What on earth? You're in this small town in Florida, like, why did you send me to Russia in 1991?" Because I left literally weeks before the coup that overthrew the government. Like, it was a weird time to be over there, but long story short is I went and I didn't know any different. It's what I wanted to do. It was an amazing experience. I found the people to be incredibly hospitable and loving and kind and welcoming. And, we were a bit of a novelty, but I was able to receive this world renowned training and bring that with me into the next iteration of my dance career.
Spectacularly amazing. I'm just trying to picture that moment, and I am a visual person, so I'm drawing some images in my brain. As I ask you the next question, I really want you to think about slowing this moment down for us a little bit. Take us to that moment where you realize, oh, my perfectionism, or did you even realize it at that time? Like the perfectionistic tendencies were when they started to become intrusive, and that point where the eating disorders started entering the moment.
That point would have been probably 20 to 25 years after this point in time that you and I are talking about now. It certainly was not part of that. I certainly had lots of feelings of discomfort that I was trying to avoid, and I mitigated that with food behaviors. And then when I couldn't dance anymore, I knew I could work hard. And so I went back home to Florida and got a career, went back to college and decided to go to med school. I mean, obviously, dancers and doctors are the same people. It's lots of workaholism, lots of perfectionism, some narcissism, but I knew that I could work hard. And so work kind of became my drug of choice. And so I worked and got into med school and was a great resident of the year multiple years in a row, and then got a job in a really high profile practice. So work kind of became my avoidant behavior. And then as 15 years into my career, COVID happened and work certainly was not a way to avoid discomfort at that point in time. And so alcohol kind of upregulated at that point in time. So I was either working or unwinding on Fridays and Saturdays with alcohol to a place that I felt like that was problematic. So I say all that to say that perfectionism was in the background of all of those things. It wasn't always perceived as this black and white, all or nothing perfectionist behavior, but there was multiple ways in which I avoided myself, my feelings, my identity, my truth by just staying perpetually busy or numbing with work and other things. And so it wasn't until I was absolutely leveled about 7 years into my career with professional burnout that I had to start to come to terms with what I'm doing is not working. I certainly wasn't ready to change my behavior, but it was the first time where I couldn't run from it anymore because I was truly not able to get out of bed. And it started me on this journey of therapy and coaching where, not surprisingly, I got really interested in perfectionism and put these pieces together like, yes, of course, people pleasing and overworking and my really loud imposter, inner imposter, all were related to those avoidant behaviors to a place where it just wasn't helpful anymore. And I think we become the people that we really needed. And so I, of course, started coaching other physicians on perfectionism and how they could be less perfectionistic, but I still was doing a ton of inner work to start healing that wounded part of me that could not tolerate discomfort. And it wasn't until I did that work in my 40s that I really could have told you, oh, yes, it was perfectionism related things all along.
And now, in addition to all that wonderful work that you do, you help your patient population is very specific. You help patients with eating disorders. And yes, you do other care for other primary care patients as well. What does the research tell us about the connection between perfectionism and eating disorders?
Yeah, there's a lot of reasons why people develop eating disorders. And to be clear, there's many types of eating disorders and eating behaviors. But The reasons why people develop them are vast. Certainly, there's plenty of data around genetics, family history, environmental factors, but the kind of rigid, over controlled personality type, which lends itself heavily to perfectionism, we definitely see an overlap between that and some of the food and control behaviors that we see. It's not the primary cause, but I think of it as like priming the pumps. If you've already got people who are a little rigid or black and white thinking and rule following around foods, there's usually an inciting event that like tips them over and then starts the avalanche of food related things. So it's definitely there. It's not in everyone, but it's definitely there.
What strategies you think have been helpful for you as well as other humans that you've helped when you think about your journey with perfectionism through it all, whether it's that younger 8th grade version of you and onwards, you might be doing some of those things subconsciously at that stage, even though you later had the realization that perfectionism was the common thread that tied all those events. What works?
The shortest answer is self compassion, although that was the furthest thing from my reach when I started doing this kind of healing work. What was much more accessible to me was this idea of fierce self-compassion. If you think of the traditional self-compassion that Kristen Neff talks about, it's this like hand over heart, loving, nurturing, you're worthy, you deserve to have a life of peace and joy and meaning. That felt totally inaccessible because I didn't have a lot of love and compassion for myself. But what I did have was the ability to advocate for other people. And I think for anyone in caregiving fields, not necessarily only healthcare, if, especially if you're a parent or you have a loved one that you advocate for, it's really accessible. Like, don't mess with my patients. Of course, I'm going to go to bat with the insurance company for them. Don't mess with my kids. Of course, I'm going to be mama bear when it comes to something that I think is not working for them. And I knew that I could advocate for other people. So at least recognizing that I had this skill and starting to apply it towards me, it wasn't even the me of today that could tolerate it, but I could look back, as you said, at the 13-year-old version of me and be like, yeah, she was doing the best that she could with the tools and the resources and the knowledge that she had at that time. And yeah, overworking helped her in that season of life until it was no longer helpful. I could look back at the young parent version of me where I was drowning in diapers and patient charts and all the things. And I could know that even though I felt like I was failing at the time, like, man, I was really killing it. I was doing the best that I could, even though it felt really hard. And so that stepwise, incrementally bringing self compassion a little closer to the version of us today, it may start externally, applying it to other people, and then to perhaps younger versions of you that you have a little bit more compassion and forgiveness for, until a place where I can clearly remember after work being in this after hours meeting which was super frustrating, and we were talking about doctor-related stuff, and I finally just said, like, "I can't do this anymore."
Mm.
But more specifically, I won't do this anymore. Like, I deserve to not feel depleted and exhausted at the end of every single workday, and I think it was the first act of self-compassion that I ever had, and not surprisingly, it was during the pandemic, which is the thing that finally got me started towards leaving a job that was toxic for me and building my own practice. So the short answer is self-compassion, and then probably 2 other things that I think are helpful are, what they would call borrowed benefits.
Mm.
If you feel really resentful towards someone else who is exhibiting a lot of self-compassion, your inner critic may think, "Oh, that person's just lazy," or, "Oh, that person just, like, doesn't care about quality," or, "Oh, they're able to let things go." But that resentment is pointing you towards something that's really valuable that you probably want or don't have. So it's okay to borrow the benefit of someone else's compassion in that way. And then lastly, life is short, and one day we will all be on our deathbeds. And to be able to stand in that space and look back at the season of your life and say, like, what would I regret doing or not doing right now? And if you're like, look, like, even though I look good on paper, I am miserable and this is not it. I think looking and understanding you would regret what's happening, even if you don't know the how of how to fix it, just the acknowledgement of your own suffering right now is a beautiful place to start. It's one of the 3 limbs of self-compassion. So,
That was so powerful. Thank you for sharing that. And I really want to echo what you said in terms of self compassion itself just felt so inaccessible because that's exactly how I have felt during this journey. And the self critic is so loud and everything else that you mentioned. Resentment can be a big teacher for us. What is it trying to tell you? Why are you resenting somebody? And cynicism probably was one of the main core symptoms, I would say, I'm thinking back when I had burnout. I
Mhm.
just look around all these people and they're trying to be so bubbly and happy. And you're like, are you kidding me? Please
Yes.
take all that positivity away from me. And it was so big because I am a naturally more optimistic and positively aligned human. And so when I found myself in that space, that was also a big part. I have a question in specific. I jotted it down while you were talking, and when you said that, self-compassion remained inaccessible. Somebody who's listening, and often I talk about self-worth and the way we view ourselves. And then we talk about self-compassion. What would you say to somebody who really struggles with like self-worth? And this is where in perfectionism it also comes in, where there's this space, I have to appear this way, and only then will I be worthy. Any thoughts?
Yeah. When I would think of self-compassion, it felt sickeningly sweet to me. Like, that's cute, but I have, like, real life things that have to get done, and, like, there's no space for that. I think it's helpful just to understand what self-compassion is. There's 3 limbs. One is noticing your own suffering and being able to name that. The second is recognizing that as part of the human experience. Like, of course, it feels really hard when you're drowning in diapers and work responsibilities. Of course, other people would feel like this is really hard. It helps you feel less isolated. And then the third part is doing something nice or being kind to yourself and saying, like, you did the best you could under those circumstances, even if it didn't turn out the way that it needed to. So, naming it, normalizing it as part of the human experience, and being nice to yourself, that's it. And if those things feel really inaccessible, the yin to that yang is this fierce self compassion that I mentioned earlier, which is like tightly aligned with the social justice movement, the Me Too movement, like the same thing that I use with my patients. Like, don't mess with my patients. Like, insurance companies, you're driving me crazy. Or like, if someone's being mean to my kid, I'm like, oh no, stand out of the way. Like, we're going to talk to the teacher, right? So that white, hot, fierce advocacy is also compassion, and to be able to advocate that towards yourself, like for me to even notice and finally name, like, not just I'm burned out, but if you're feeling like you are drowning every day and depleted every day and there's nothing left in your life for the things that really matter to you, to be able to say, I don't want to live like this anymore. I don't want my life to feel like this anymore. I want it to be better. That is the first like baby step towards advocacy, just to even recognize and to not continue to numb out through other things. That is the first step. It's just noticing that you're suffering.
How have you reimagined success for yourself now? And what advice would you give other perfectionists? I know you mentioned self compassion, but anything else?
Success for me looks very different. I think having stood at the top of the mountain, meaning I looked great on paper, I was resident of the year, I'm Atlanta's top doc every year. Like, there's that. And none of that stuff really matters to the people who love me for me. They don't love me because I'm successful. They love me because of how I presumably make them feel or how I take care of them or how I am relationally to them. And defining my worth outside of what I do and who I am took a lot of intentional work to even just know who I was to begin with. And so success for me is now much more aligned with what I value as opposed to what I do for a living or do relationally. And I know that I've had a successful week when I have white space during my day because that's when like the best version of me comes out. I know I'm really successful when my kid comes up to me and asks a question and I can put my phone down and not feel agitated because there's like 10,000 other things on my mind. Success for me can feel like a good night's sleep. So when I think about my core values, which is connection, creativity, curiosity, and autonomy, if those things are showing up in real time in my life, like that feels wildly successful because, again, on my deathbed, I'm not going to wish I saw one more patient today. I'm not going to wish that I got another accolade. I'm going to wish that the people that I've devoted my life to actually want to be with me. And that feels like the version of success that's worth sacrificing for now.
Thank you for sharing that extremely powerful thought. It's going to be very introspective for a lot of our listeners. It is definitely for me as you kind of think from the end on how you want to live right now. Kara, how can everyone get in touch with you, learn more about you?
Oh, thanks. If you can remember my name, you can find me. It's Kara with a K. Kara Pepper MD is my handle on all social media. You can find me at Kara Pepper MD as my website, both from a patient and a coaching standpoint. And then if you're always interested in just sending a line, it's hello@karapeppermd.com.
Thank you so much for your time today. This was wonderful.
Thank you for having me.
This episode is part of a special series and my budding book project on unmasking perfectionism.
Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.